It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, we have a new physiatrist in town. So what's a physiatrist? Well, folks, on the show today, we have a new doctor joining us, joining the Greater Hazleton Health Alliance. His name is Dr. Ammar Abbasi. He looks like he's 18, but he really is a little bit older than 18. He's a young guy, but brings a lot of experience to the Health Alliance, and it's going to be a pleasure talking to him today. Hey, Doc, how are you?
Good, good. Pleasure to be here.
It's always a pleasure to see you. I'm excited because the Health Alliance continues to amaze me. They're bringing great doctors in, and it's very refreshing.
They're growing very rapidly, and it's great for the community.
So it's Abbasi, Ammar Abbasi, right?
Yes.
Yeah. Now, where are you from?
I'm from New Jersey.
New Jersey. What
part of it? Right across the Delaware Gap.
Yeah, I know where New Jersey is. What do you think?
Oh,
I don't know where
it's close by?
Yeah. You think I don't know where New Jersey is? Don't know where New York is, but I know where New Jersey
Jersey
is.
Shore is taped there.
Your background?
In terms of educational experience?
Yeah, education, yeah.
Yeah, so really it's in, most of my training has been done in physical medicine and rehabilitation work. And, I went to school at Rutgers University for college, and then went to Robert Wood Johnson University. And they have an associated rehabilitation center, and that's called JFK Johnson Rehabilitation Institute. And they're big in head injuries and things like that, and that's where I did most of my training.
I find it interesting because it's called a physiatrist. Some people think it's a psychiatrist. And folks, it is not a psychiatrist, it's a physiatrist. But to make it easier, it's called physical medicine and rehabilitation physician. Now, what is a physical medicine rehabilitation physician, for my sake and sake of the viewers?
Sure. It's a new field. It actually was born sort of after the Second World War. And it was looking, the pioneers of the field were looking at the patient populations coming back with certain disabilities, amputations and traumatic brain injuries and this type of thing. And really the focus of the field is how to get these people back to doing the things that they were doing before and improving their quality of life. And that's really the type of work that we do. So the field has evolved over time, and it's not only just for these type of severe injuries, but physiatrists have become really experts in function and the ability to move arms and legs and walk and get around and be able to participate in things that people want to do, on an everyday basis. So you'll see different physiatrists or physical medicine rehabilitation physicians specialize in different areas, such as brain injury or spinal cord injury, or in my situation, musculoskeletal, or muscles, nerves, joints, and strokes, this type of thing.
It always fascinates me, Doctor, when people who become doctors or lawyers or businessmen or if they just labor, not just laborers, but laborers, who work hard. When did you decide you wanted to become a doctor, and why did you go into the physical medicine side?
Well, I'll tell you, I used to work in the computer industry, and while I was in high school, I was working in software development, and I noticed that after 4 years of working in there, I got laid off because the market sort of imploded on itself, and I decided from then that I wanted to do something that if I got laid off the next day, at least I accomplished something the day prior, and I fixed something, and I fixed somebody. So that's really where I started to look at medicine as a possible option with that. And I got into that field that way. While I was in medical school, I was kind of disappointed with medicine because I thought it had a lot more to do with people. And I didn't feel that I was spending enough time with my patients or learning enough about what they wanted. And I stumbled upon the field of physiatry because a friend of mine said, hey, this is great. You should, based on what you're saying, you should really come and check this out. And it was associated with our university, and I went to see the head injury units there, and it was a really beautiful thing. We were able to spend time with these patients that have had some really traumatic history, really get to know their social stories, get to know their families, get to know who's taking care of them and what's going on, and then really work on different aspects of their life to get them to the point where they can function as independently as possible. And it's really about working with people and their families, and I really like that. And
no one else in your family is a doctor?
Not in my immediate family.
So your mom, your dad, no one's, because sometimes, if your father or mother, or if there's relatives, you just decided, I'm going to go into medicine, and this is the route you take. You have to. I always say this to the doctors that I'm interviewing, and you have to have a passion for what you're doing. Okay, I could see you just love people.
Oh, I love it.
Yeah,
I love this kind of work.
Yeah. Now, let me ask, what types of symptoms, or problems should I visit? Now, again, folks, it's physiatrist, but I'm not going to use that word anymore because some of you may think I'm saying psychiatrist, even though I may need one, but this is a physiatrist. So it's a physical medicine and rehabilitation physician. So what are some of the symptoms or problems where I said, oh, no, I better call Dr. Abbasi up?
Well, I think for myself, my real specialty is musculoskeletal medicine, or looking at people's muscles and joints and alignment and posture. And so if you have pains in your neck and back and elbows and knees and hips, and it's limiting what you can do on a day-to-day basis, we can really provide a service to you and do a very good evaluation and try to fix what's wrong physically. Also, if you've had a stroke and you aren't able, now you're past that period where you're medically stable and you go home and you're trying to get back into doing some of the routines, or even getting to the point where if you're less reliant on a caregiver, let's say, a physiatrist can really help in transitioning people back to home and getting them as independent as possible at home, when we talk about feeding, when we talk about showering, grooming, toileting, and this sort of thing. Of course, walking, a major one. Not to say that everybody will be able to do all these activities, but we look at each case and we see what we can offer to really give better quality of life for those type of people.
Okay, so let's say I'm having some of those symptoms right now, and I call your office, which the number, folks, is 501-6380. 501-6380. We'll tell you that a couple times. So what can I expect, okay, during an office visit with you, a physical medicine and rehabilitation physician? What can I expect?
Well, first we would discuss really the history that's surrounding your injury or your problem, and we'll really dig deep and see what are the circumstances that cause that. Either it's a mechanism of injury or something like that, and how long it's been going on. We'll explore the different treatment options that you've been through, as well as you all right?
Yes. Yeah.
Do you need a doctor?
No, I got a doctor right here.
We'll explore the different treatment options that you've been through and what's worked and what hasn't worked. After that, we do a very thorough examination of all your joints, the ability for you to move your joints, look for any type of muscle weakness, look for any type of bony abnormalities or alignment problems, and really also test the neurosystem, the nervous system, and make sure that that's working well, and if there's any problems in that, identify those problems. We'll also delve deep into the social circumstances that you're facing on a day-to-day basis. What things were you able to do before this happened, this incident or this injury happened, that now you cannot do, that you would like to be able to get back to doing? So we'll discuss that, and together we'll form goals and come up with a plan.
So give me a typical case, okay? Because again, there may be some people who have had injuries or are having problems with their whatever injuries. Give me like an example of a patient, without naming a person, who would come to you with this particular ailment or injury.
Sure. So we could have somebody that comes in for, let's say, a routine back pain.
Okay, routine back pain. Okay?
Yeah,
they can't get rid of the back pain no matter what they do, and so they come to see you.
Right. They may have burning and numbness in the leg. They may not. They may just have pain when they go outside and do some gardening work, or they do the work around the house. And I would ask them, when did this first start? How did this sort of happen? And really get a good history and feel for what exactly was the mechanism of the injury, and make sure that I don't have to do any further testing to make sure that there isn't any real threat to the person's future medical stability. Mm-hmm. After that, I would test their strength in their legs, look at the skin, look at their reflexes, and make sure, even watch them walk and see, is there anything there with respect to bony alignment or the muscles where I can see some weakness or anything of that nature that I can identify as maybe being a cause or a root cause of the problem. And once we do that type of evaluation, the next step would be to tailor a treatment plan for them. And they'll follow up, and that's how that kind of thing will go.
So that's one of the process. Okay, so what type of treatment options does a physical medicine and rehabilitation physician offer?
So we pride ourselves on being more conservative in our care. So
what do you mean by that, Doc?
Meaning that we're not going to operate. We don't.
Well, that makes me think they want to come to, because everyone fears that in the beginning, unless it's
needed.
Yes.
And that's part of the initial evaluation process, knowing that, hey, does this person need to go see a surgeon, or can this be treated conservatively for now, and we can watch and wait? And so what we really rely on and who we work very closely with is a physical therapy, the physical therapists, occupational therapists, and speech therapists who really specialize in treatments of these muscle weaknesses and problems in walking and doing daily activities. And what we would do is we would work with that team in tailoring a treatment program, a therapy program for them. Now, let's say, for instance, you're so much in pain that you can't participate in therapy. Well, the physiatrist or the physical medicine rehabilitation doctor now can either prescribe medications or do some type of joint injections or these type of things in order to help make you augment therapy or get you to the point where you can benefit the most from therapy. Okay. So we'll be monitoring your therapy progress and making any type of interventions that are needed on our end to make sure that you're getting the most out of the therapy process.
Okay, so maybe the next answer to this question will answer another question I want to ask you. What is an EMG and nerve conduction study? That's an EMG and nerve conduction study.
So that's a study, EMG stands for electromyography, it's a big word. Nerve conduction study, or NCV, is another thing or NCS is another thing that, it's an abbreviation acronym for that kind of thing. This type of test goes very well and hand in hand with what physiatrists do because we evaluate muscles and nerves. And if we see somebody that has muscle weakness, they can't get out of a chair, or they have nerve pain, they have numbness and tingling, and they don't know why, and it's so painful that they just can't do their work. This type of test really evaluates the muscles and nerves. It's no real replacement for what the doctor's assessment, but it can really help to confirm a diagnosis that we may be suspicious of. Basically, we test the nerves and see how they function, and then check the muscles and make sure that they're functioning normally. And if those two things are functioning normally, then at least we can say, hey, it's not your muscles, it's not your nerves, this is a different type of problem, and we can address that.
Now, is this a painful exam?
Well, the nerve conduction studies aren't painful. It's more of a discomfort that we would describe it as. It's because we do a small static shock to fire off the nerve.
But nothing that is going to drive me crazy. I mean, it's just a discomfort to find out what's going on. I mean, it's not a because we have people maybe who are in pain right now and are not mobile, and they just about could get up from the couch to go to the bathroom or whatever. And maybe, you could be a help to these people, all right? And I think some of them would, I think when a person becomes stagnant or they don't move, they have a tendency to stay that way longer, and they don't want to move and are afraid to do something. And maybe I have something very seriously wrong with me, and which is the wrong way to think.
You're absolutely right.
Yeah, it's the wrong way to think. If you are, sedentary, just staying and not doing anything, I highly recommend that they give you a call, at least come in for an exam, correct?
Yes, absolutely. Absolutely.
Now, they say a body in motion stays in motion, which is very truthful. In fact, doctors will tell you that, when you're moving around, it lessens your inflammation in your body and all of that stuff, and it's a good thing. I think anybody who just sits all the time really isn't doing so. What advice do you have for those kind of people?
Well, it's a funny thing about muscles. They don't like to be overused. They don't like to be underused. So some type of light to moderate activity where, if, let's say you're walking 3 to 5 days a week, if you're able to do 3 to 5 hours a week, I'm sorry. If you're able to do that, that kind of work, that's really putting yourself in the best position to continue throughout your life as you age and continue having pretty normal function.
You'll find out sometimes, and the question here is one of the problems you must see most often is joint pain, and that's primarily a lot of people that say, okay, now when I come to you and I'm in pain and I have these joint pains, you give me that test or whatever you found. Does diet play any part in joint pain sometimes?
It can. There's a lot of literature out there that's saying that a high carbohydrate diet, a diet high in sugars and these the sodas and this type of stuff can really cause you to have a total body inflammation. And so there's some literature out there saying that this type of diet, where if you're going high sugars, high carbohydrate diet, that really can cause you to have more joint pain, more belly bloating, and this type of thing. So it can contribute.
Do you do you work with a person in that respect?
We do have a dietitian at the Hazleton Health.
I mean,
and Wellness
when
Center.
you're looking at, because if you're doing a complete analysis of the person, you want to try to find what the causes are and then the symptoms. But, if they tell you, well, I eat a lot of sugar, I drink a lot of soda, I smoke cigarettes, whatever, I think that would be a help to them.
Yes, we keep that in the back of our minds. We want to make sure, first of all, that it's not anything structural or anything else wrong with the joint. Is it any type of bone-on-bone that's happening, some bone irritation? Is it a muscle irritation? Is it a ligament irritation? Did they fall or do something that can be the reason why? Do they have any type of other process that can be going on? And then if we've ruled all those things out, then we can really start to address the diet and go from there.
On a side note, doctor, the funny thing is that, I talk about the great doctors, and believe me when I tell you, we have tremendous doctors in this area. And I think more and more people are beginning to see that. As many years ago, it was like, well, we got to go out of town. Well, you find out you go out of town, you get interns, and even in Philadelphia or wherever you're going, and we have an array of fantastic, professional, experienced doctors in this greater Hazleton area, of which I'm very proud of, and medical staff. With that being said, the fact that some people are in pain every day, okay, I'm not going to say there's no reason for that, but they are in pain. But what we have available to them is, particularly in your case, where you're there to say, look, if you have these pains, any kind of pain, if you can't move, or back pain, joint pains, etc., you may have a solution for them.
Yes, and one of the things I ask people to do is to take control of that pain and say, I'm so much in pain, and this is limiting me so much that I am willing to go through this program and really do these exercises and really go through the therapy and do everything I need to do in order to make myself
So you find
feel better.
sometimes a person comes in and they're reluctant to come in, but they finally come in, they're nervous, they're in pain, etc., and then you start the process. I'd love to have a testimonial of a person who says, I didn't want to go, it's blah, 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 and I'm afraid, and all of a sudden, and then as they begin the process and they begin to see how it's working for them, wow, they're their biggest fan, and they're telling everyone, you got to do this, you got to come here. I'm sure you have a lot of patients like that.
Yeah, it happens all the time. It happens because people after traumatic injuries or even when they have chronic pain because of something that's been going on for a long period of time, they feel uplifted when they can finally sort of switch the dynamics and say, I have control of this. I'm taking ownership of this, and I can actually do something about it.
It reminds me of a person who's overweight 50 pounds, and they, just to get them started. Once they get started and they lose 3 pounds, 4 pounds, well, they're feeling good. Then they lose 10 pounds, and wow, and then they're on their way, and wow, this is the greatest thing since sliced bread. Folks, if you just tuned in, I'm talking to Dr. Ammar Abbasi. Yes, he is a doctor. He's not a kid from high school. We have young doctors coming in, and he's well experienced. He is a physical medicine and rehabilitation physician known as a physiatrist. Now, getting back to if I have back pain or any kind of pain, how does therapy help with joint or back pain?
Well, it's interesting. Like I said before, when you look at joint pain, it can be from a number of reasons. It could be because of bone-on-bone irritation, which is arthritis, osteoarthritis, they call it. It could be because there's ligaments and structures around that area that could be overused or irritated. It could be the muscles itself that are weak and not protecting that joint and not doing what they need to do. So when we do our evaluation, we look to identify what piece of that is causing this problem. And from there, we send these patients to therapy, which, by the way, when we're at the Hazleton Health and Wellness Center, my therapists they're right next door.
Yeah, well, you're at the wellness center.
I'm at the wellness center, and they're right next door.
Which is great.
Yeah, I literally, we've been doing this with patients all along. Walk right over and say, talk to the physical therapist. How have things been going in therapy? How is the patient? Yeah. What are the barriers? What's stopping?
You're monitoring it very good too.
Yeah. No, that's one of our major jobs, is to make sure that things are going well in therapy, and that if there's any modification that needs to be made in the exercises or in the treatment plan, that we do that. So the therapist and I would, as a team, we come up with a tailored program for muscle strengthening, joint protection. Even it might be something as simple as just changing the way somebody lifts an object or the way somebody positions their body. And so we work with the therapist to get to the patient to that point where that becomes second nature, so they're not re-injuring these joints.
Now, in this area, there are a lot of people, I don't know the percentage, but who had strokes. And certainly that is a cause. Now, when it comes to a stroke victim, okay, those people that have had strokes, and you're evaluating them, in your office. So what is it, that you can do to help these stroke victims continue a good quality of life?
Well, it's very important when somebody has a stroke, as they really do differ a lot in severity. Some people have more lower limb affected, some people have more of the arm affected. So it's very important we look at, say, what were they doing before, and what support systems do they have at home, and what can they, and bit by bit we really attack sort of each piece of daily living, the activities of daily living, being able to get up out of bed, or being able to get onto the toilet, or being able to feed and groom, and doing all this, putting on and off the clothes, these activities of daily living that we need to employ. So we do a very thorough assessment to see what things does the patient need us help with. And based on our exam of the muscles and the joints and everything else, we can really identify how either do we need to use some type of assistive device, or do we need to do some family training, or can we do some strengthening of certain muscle groups, or sometimes there's certain injections that we could do to sort of loosen some muscles that get very tight over time in stroke victims. Really to get them to the point where now they're becoming more independent.
Let me ask you something, doctor. There may be some stroke victims that have had strokes maybe 5-10 years ago, and are maybe either in wheelchairs or walkers. Maybe their speech is not, maybe some of them can't even talk that well. And let's say they've been 10 years, 15 years they had a stroke, and they've been living that way. Is there any hope for these people now, even though they've been in that condition for 10, 12 years?
My feeling is there's always hope. And the only real way to know what we can attain is to try. And so by not coming in to see and get evaluated, they're not really giving them themselves a chance to flourish and progress.
Sometimes people think, well, no, he or she has been that way, and we've been to the doctor, we've been to therapy. That's just the way he or she is going to be, and I think sometimes they may be right, but they could be wrong. With the advances in medicine that we have, and people like you who come with a lot of new experience, I think if you had a stroke or you're in a certain condition, it may be worth your while just to go and have an appointment with you, just to see if there's anything. Hey, what do you got to lose?
Yeah, it's true. We offer a very fresh and different perspective, because
that's the word, fresh and different perspective. Yeah.
Yeah.
So there may be some hope out there for people who have been in this condition for a while, even though their speech has been gone for, some of them may just write or groan or whatever. And of course, their spouses know what they're saying because they're living with them. They know, well, he means this or she means this, or he wants this or she wants that. There may be some hope there, okay? Have you seen any of those things? Have you ever had anyone or know of anyone who has had a stroke for a number of years and then decided to come to a physiatrist or a physical medic and rehabilitation physician? And was there any things happening with the people in that condition?
Absolutely, because of that disease process, people start to get into a mode where they start to rely on everybody around them to do everything, and they start to feel helpless and hopeless. So it may not be that we get this person to start walking again, but it may be something as simple as this person now has independence in doing something that they previously needed help with. And that is the difference in someone's day between feeling totally dependent on their family and feeling that they have some control over their situation.
Does age play a factor in this?
Age does play a factor. Also, the time from the stroke does play a factor. So the best scenario is to see somebody pretty soon after they've had their stroke.
Well, I'm talking to people who have had strokes and they've been around for 10 years or 12 years who have just, are just existing, okay? Again, the odds may be or may not be in their favor. However, if there's any kind of hope there for at least a better quality of life, do you see that, or is it just, hey, you are what you are?
No, I definitely see a hope, and what I want to stress to everybody is that it's very important that the person's attitude, that's what we want to work on, because a good and positive attitude where someone's going to really be aggressive in their treatment program and really do exercises that we prescribe at home and everything else is the difference between being able to do something on their own and still needing somebody.
You said a word that is so key. Attitude is everything. And people, and first of all, you're looking at the biggest baby walking the face of the earth. It took me 3 years ago for colonoscopy. When I go to the doctor, I'm a nervous wreck. I'm a big baby, period. So let that be said. Women, I think, are the strongest people in the world. They can handle a lot of things. God forbid I should deliver a baby. With that being said, attitude, I think, is so important, because I've interviewed many doctors and been in different places, and I've seen people who had some severe problems, but their attitude is great. And I see faster recoveries with people who have a very good, positive attitude in life.
Oh, you're absolutely right. In fact, we also deal with amputees and providing them prosthetics and with stroke victims sometimes orthotics and these type of things. But I've noticed that the amputee population, after they get through their first couple of months where it's very difficult, they really have a different attitude and a whole new look on life. And they're actually some of the happiest patients that we have.
Yeah, and they show so much hope. The Wellness Center is doing extremely well up there. That's where your office is, right? Okay.
Yes.
A friend of mine who is Art McCormick goes up there every day. Okay. Now Art's a young guy. He's only 90-some years old, and he has an attitude that's unbelievable. He's up there working out every day. He's a beautiful person, and he inspires me. He inspires me, and come on, get up there, and he's up there, and they call him Artie. I'm sure you've seen him there.
No, absolutely.
Yeah, he's a great guy, folks. I'm talking to Dr. Ammar Abbasi. He is a physical medicine and rehabilitation physician, known as a physiatrist, not a psychiatrist. And I know what you're thinking. I need a psychiatrist. Hey, Doc, if I want to get in touch with you, okay, I'm going to put a number, folks, is 501-6380, 501-6380, to make an appointment or to ask him any questions. Before I go to break, I want to ask you something. A lot of people come in this area. We have a lot of great doctors who are moving here. How do you like the area? What are you fascinated about this area?
I love this area. I didn't realize how city I was until I came here, but I really enjoy the openness of the spaces. The valley's beautiful, and the mountains, the topography. I was here in the fall. It's you guys. This is America's best kept secret up here. So let's keep it that way.
How about the people?
The people are very nice. In New Jersey, we go to the stores. Nobody says anything to you. Here, everybody's saying hi. I'm looking around and saying, are they saying hi to me?
And that's what we talk about all the time. We're very proud of what we have here. And sometimes we, natives, are our own worst enemies, okay? And we, have a tendency of criticizing where we are, no matter what municipality. And we have a lot going for us. And let me tell you something. The people here are very good-hearted. We may have a little disagreement politically, but they are very warm and good-hearted. And that's why the reason I opened my facility here. I wish you the best.
Well, thank you so much. Thank you for having me.
It's my pleasure. I'm going to come up and say hi to you, okay? And maybe Artie wants me to get up there because I have to lose about 10 pounds,
I could be your coach.
Could you work on that for me? Okay.
We'll work together.
Dr. Ammar, folks, Dr. Ammar Abbasi, great guy, 501-6380. Give him a call. No reason to sit around, folks, with those pains that you have. No reason whatsoever. Come on, get off the couch, make the phone call, get in touch with him, and I'm sure you'll feel better. I'm Sam Lesante. We'll see you next time.